Welcome to episode 10 of our weekly video podcast. Today, we're going to talk about the Respite and Holiday Care Services. Stay tuned.
All right, everyone, welcome back. You guys wanted to hear more about respite and holiday care in the UK? And we heard you. So today we're diving deep with some insights from Medicare Hub Limited. They're a leading provider in this space, and they've got some seriously interesting things to share.
Absolutely. This is a topic that deserves all the attention we can give it. It's about looking after everyone involved.
Yeah.
Really? The people who need care and their amazing caregivers.
Okay, so let's start with the basics. For anyone who might not be totally familiar,
Sure.
Can you give us a quick explanation? What exactly are respite and holiday care?
So respite care is like, I think of it as a break for caregivers. It's temporary relief.
Yeah.
It can be just a few hours a week, maybe an overnight stay. It could even be longer.
Gotcha.
It really depends on the situation. And holiday care takes that idea even further, providing care, but in a different environment.
Oh, interesting.
Sometimes even with a bit of a holiday feel to it, something to look forward to.
That's a fantastic idea, especially for folks who might not be able to take a traditional holiday.
Exactly.
But why are these services so important? I mean, we know they're good, but what makes them crucial, especially here in the UK?
Well, think about it. The UK's got an aging population. Healthcare costs are rising.
Yeah, that's true.
It puts so much pressure on families, on the entire social care system.
Yeah.
Respite and holiday care, they're not just nice to haves, they're vital. They help prevent caregiver burnout, which is a huge issue.
Right, because if the caregiver is exhausted, the quality of care suffers.
Exactly. And, it can even lead to fewer hospital admissions because people are getting the right support at home.
Makes sense.
So in the end, everyone benefits. It's about improving quality of life across the board.
That's a really compelling point, but we have to acknowledge the elephant in the room.
Oh, absolutely.
Medicare Hub Limited is very upfront about the challenges these services face, and they're not small issues. The first one that jumps out is accessibility and funding. And this is a story we hear all too often, unfortunately.
Sadly, it is. I mean, in the UK, access to state-funded respite care, it's often really limited. There are these long waiting lists, and the eligibility criteria can be incredibly strict.
Wow.
Which pushes so many families towards private providers. But then that becomes a financial hurdle.
Yeah, it's a double-edged sword.
It is. And it's not just anecdotal, there's data to back this up. A study just last year, in 2023, found that over 60% of unpaid caregivers in the UK were having to make sacrifices.
60%, that's alarming.
It is. They're cutting back on essentials, dipping into savings, all just to afford respite care.
It shouldn't be that way.
It really shouldn't.
And on top of that, we've got the issue of availability, or rather, the lack thereof.
Yeah.
And this seems to hit rural communities particularly hard. It's almost like where you live determines the care you can access.
You're absolutely right. It's a postcode lottery.
Right.
And there are a few reasons for this, you see. Rural areas often lack the infrastructure, the specialized facilities, the trained staff.
Yeah, even getting there can be a challenge.
Exactly. Transportation is a huge barrier. So many families in remote areas, they're left with very few options.
Right, and that feeling of isolation gets amplified.
Precisely.
And then there's the personalization aspect. The idea that everyone gets the same care regardless of their individual needs.
Ah, yes, the one-size-fits-all approach. And let me tell you, that can be incredibly frustrating.
I can only imagine.
For both the individual and the caregiver, of course, because every person needing care is different. They have unique needs, preferences, things they enjoy.
Absolutely.
You can't just apply a generic care plan and expect it to work perfectly. It leads to dissatisfaction, anxiety, and ultimately, the care just isn't as effective.
And I think that's a really crucial point. Can you give us an example of how a personalized approach could really change things, make a tangible difference in someone's experience?
Let's say you have someone who's always loved gardening, right? Always been their passion. A truly personalized respite care plan, it might involve activities at a local community garden or maybe even visits to beautiful botanical gardens.
Yeah.
It's not just care, it's engaging with their interests.
Yeah, it's about enriching their lives.
Exactly.
And finally, we can't forget about the caregivers themselves.
Oh, absolutely not.
They're the unsung heroes in all of this, providing incredible support, but often at a personal cost.
It's often said that caregivers are the invisible backbone of society.
And it's so true.
It's so true. They're the ones who keep things going. But that constant demand, it takes a toll.
It does.
It can lead to exhaustion, stress, even serious health problems.
And if they don't get the support they need, they risk burning out.
which ultimately affects the care they're able to provide.
Right, it's a cycle.
A vicious cycle. And that's why support for caregivers is so important.
It's not just a luxury.
It's an absolute necessity.
So we've talked about the challenges, and they are significant. But what I find really inspiring is that Medicare Hub Limited isn't just pointing fingers.
No, they're not.
They're actively developing solutions. Let's dig into their approach.
Yeah, Lex.
They have this four-pronged approach that sounds incredibly well thought out.
It is.
And they start with personalized support plans. This isn't about ticking boxes. It's about seeing the individual.
Precisely. They move away from those generic templates, the ones that try to fit everyone into the same mold.
Right.
Instead, they take the time to truly understand the person.
So it's about more than just their medical history.
Oh, absolutely. It's their personality, hobbies, their likes and dislikes, everything that makes them unique.
So they're really trying to get a complete picture of the person, not just their care needs.
Precisely. And that leads right into their second focus, which is comprehensive care coordination.
Ah, now this is where they're aiming to break down those silos,
Yeah.
right? Working with everyone involved.
You got it. Healthcare professionals, social services, the family, everyone.
It's about teamwork.
Exactly. Think about it. Let's say a doctor recommends physiotherapy, but transportation is an issue.
Which it often is.
Medicare Hub steps in, they coordinate with transport services, they make sure that person gets to their appointment.
It's like a concierge service for care.
That's a great way to put it. It's about connecting the dots and creating a seamless, supportive experience.
That's fantastic. And then their third focus, accessibility and flexibility, that feels particularly relevant given what we were discussing earlier.
Absolutely. And it ties back to those geographic disparities. Medicare Hub offers a range of services,
Okay.
from in-home respite care to residential stays at their specialized facilities. And what's key is that they're flexible.
Because life happens?
Exactly. Care needs can change unexpectedly, and they understand that. They adapt.
So it's about offering choice and being responsive.
Precisely. And last but certainly not least, they prioritize supporting caregivers, which, as we've established, is so essential.
It really is.
They offer tailored respite options, giving caregivers those much-needed breaks, time to recharge and look after their own well-being.
Because you can't pour from an empty cup.
Exactly. And they even have support groups, workshops, fostering a sense of community among caregivers. That shared experience is invaluable.
It sounds like they're creating a whole ecosystem of support, not just a service.
That's a great way to put it.
Out of all of this, what really jumps out at you? What's the most impressive part of their approach?
It's their dedication to going above and beyond. It's not just about providing care, it's about making lives better.
It's about that human touch.
Yes. They're tackling those challenges head on, offering real practical solutions. It's clear they're passionate about making a positive impact.
So as we wrap up, what does all of this mean for our listeners? What's the key takeaway they should hold on to?
The big takeaway here is that respite and holiday care are essential. They're not some luxury add-on. They're a fundamental part of a caring and functional society.
I completely agree.
We all have a role to play in advocating for these services, pushing for increased funding, better accessibility, and truly personalized care options.
That's a powerful message. And on that note, I want to leave everyone with a final thought. If you could wave a magic wand and design the perfect respite and holiday care system, what would it look like? What would be at the very top of your list? Think about it, and let's keep this conversation going. Thanks for joining us for this deep dive. We'll catch you next time.
We hope you enjoyed this podcast. Please visit our website to learn more about our services at medicarehub.co.uk. Bye for now.